Hello everyone, and welcome to this training, Applying a Data Equity Lens to Questionnaire Design. Thank you for your interest in this training. My name is Patrick Madden. I'm the president of MDR, a public policy research firm focused on data and health equity issues. In this session, we will be walking through the principles and practices of equitable questionnaire design. The goal is to deepen your understanding of how to structure surveys and interview guides in ways that are inclusive, culture responsive, and designed to reduce bias through every step of the process. This topic is core to my own work, and I'm excited to share both the conceptual foundations and practical applications I have been lucky enough to work on over the past 2 decades. The Data Equity Center was established with a clear mission: promote data equity by offering resources that will inform, support, and promote data systems becoming more representative, inclusive, and collaborative within the communities they serve. This training module is designed to give you the tools and frameworks necessary to incorporate equity into your own research efforts. We'll start by walking through the step-by-step process of designing questionnaires and discussion guides with a data equity lens. This includes identifying key areas of potential bias, ensuring cultural and linguistic appropriateness, and making room for community participation in shaping the research design. We'll also address some of the real-world challenges that arise when applying these approaches. Finally, we'll look at examples and practical techniques that you can use to apply equitable design principles in your current and future work. The goal is not perfection, but progress, making thoughtful choices that move us closer to truly inclusive data collection. Equitable design isn't just best practice. It's fundamental for accurate, actionable research. When we design questionnaires equitably, we ensure that every person, regardless of background, including race, gender, disability status, language, or other aspects of identity, has a fair opportunity to participate and be heard. Inclusive design helps eliminate barriers that have historically excluded certain groups from research, particularly those that have been marginalized or underserved. This leads to data that is more accurate and reflects the full range of community experiences and needs. Importantly, equitable design also minimizes bias. That includes reducing measurement error caused by culturally inappropriate questions and reducing non-response error by making surveys more accessible and relevant to diverse audiences. At the end of the day, our data is only as good as our design. By prioritizing equity at the outset, we produce insights that not only are more valid, but also more actionable to advance health, well-being, and societal equity. Now I am going to speak briefly about community engagement. While not a focus of this presentation, community engagement is an integral part of the design process. A key tenet in our work is that community engagement is not a single event. It is an ongoing and integral component of equitable research. If we look at the standard survey design process, which includes initial questionnaire development, translation, layout and programming, pre-testing, followed by review of the feedback and survey iteration and improvement, community engagement is a critical component during each phase. In an equitable design process, community members are just not consulted, they are collaborators. Their input is critical not just at the end, but from the very beginning of the survey design. That is to say, we just don't pre-test the survey with community members as a way to collect their input. We involve them from the very start when thinking about why and how we are conducting this research and what questions to ask. This means bringing community partners into the process when selecting research topics, defining key questions, and even shaping the response options offered in surveys. A central approach that we use here is community-based participatory research. This approach emphasizes sharing and co-creation of knowledge, ensuring the research is grounded in the lived experience and priorities of the community. It is important to ask during this process, what topics matter most to this community? Are we framing questions in ways that reflect local norms, values, and language? Engaging communities early and meaningfully results in more relevant data and strengthens trust, participation, and impact. This training assumes that you have some form of community engagement already in place in your work. If this is new territory for you, or if you'd like to strengthen your current approach, we encourage you to explore the excellent resources provided by the UCLA Data Equity Center. Their guide, Engaging Relevant Communities to Achieve Data Equity, offers practical information that shows what successful engagement can look like in action. Building trust takes time, but it is one of the most impactful steps we can take to ensure our research is meaningful and equitable. Let's pause here for a moment of reflection. Take a few minutes to think about how you've incorporated equitable design practices into your own work. What did that look like? Were community members involved in shaping the instrument? Also consider the barriers you may have encountered. Perhaps you faced institutional constraints, lacked resources, or encountered resistance to this change. There are common challenges, and reflecting on them is the first step towards addressing them. Please take a moment to journal your thoughts. When you're ready, we'll continue with the next section of the training. Now we will dig more deeply into the details on questionnaire design. One important reason to apply an equity lens to questionnaire design is to reduce survey error. This includes both measurement error and non-response error. Measurement error occurs when the questions we ask do not accurately capture what we intend to measure. This can happen when questions are vague, culturally mismatched, or include complex language that's hard to interpret. It can also result from social desirability bias, when respondents answer in a way they think is expected, rather than answer honestly. Non-response error, on the other hand, occurs when certain groups are less likely to respond to a survey. This often is the result of overly technical language, long or burdensome questionnaires, or lack of cultural or linguistic relevance. When some voices are missing from the data, the resulting findings are skewed. Reducing both types of error improves the accuracy of our data and statistical quality. It also helps to ensure that all of the voices of all respondents are reflected in the results and produces data that can truly inform equitable policies and programs. The following figure is an example of how we approach the questionnaire design process. It involves up to 3 separate meetings with stakeholders and community representatives, which can be in the form of an advisory or working group, or some other format that works for your team. Meeting 1 is used as a brainstorming meeting. In this meeting, the research team tries to do as little talking as possible, but prompts attendees to provide input about what topics or questions should be included in the survey. Much like a focus group, the goal of this initial meeting is to allow the time and space for everyone to share their opinion on the survey. I like to say there are no bad questions at this point in time, even if some do not end up in the first draft of the survey because they might misalign with the overall goals of the research. The research team takes careful notes in this meeting, and those form the basis for the first draft of the survey. Note that even in cases where we know some or most of the survey questions already, for example, when we are modeling our survey after an already established survey, or have prior questions that we'll be using, this initial meeting is still valuable to provide community and cultural perspective that you may not be aware of or captured in established survey questions. After the initial draft of the survey is produced, a second meeting may be needed to review or walk through the survey to ensure that the draft reflects the information shared in the brainstorming session and identify any additional gaps that may exist. It may also be an opportunity to ask the group which questions can be cut if the survey is too long. After any revisions, translations, and pretesting, all of which I'll talk about in more detail later, a final draft meeting is useful to review the pretest feedback and how to best incorporate it into the final draft. When we think about equitable questionnaire design, we start with the basics, writing good and straightforward questions. A respondent-first design approach asks, how can we make this a good experience for the people taking the survey? That begins with using plain language. Questions should be written in clear, straightforward English, avoiding jargon, technical terms, and complicated sentence structures. For example, it is easy for many of us to overcomplicate our sentence structure by asking something along the lines of, to what extent do you support? Rather than asking the simpler, how much do you support? Because the latter might seem more childish. It is important to avoid negatively worded or double-barreled questions. That is, questions that ask about two things at once. These have been shown in experiments to consistently confuse respondents. Similarly, leading or biased questions, ones that imply a correct answer, can introduce serious response bias. Often these can be subtle. How much did you enjoy this service? Is an example of one that assumes one receives some level of enjoyment, even if we provided an option for I did not enjoy this. Building on a respondent-first approach, we also need to think about the structure and flow of our questions. Another mistake is asking multiple things in a single question, which will produce unreliable data on both items. This is most common when you are trying to shorten a survey and do so by combining questions or topic areas. Instructions should be embedded directly into the question when possible, rather than placed in a separate location. This helps respondents understand exactly what's being asked without having to search, or sometimes not search, for additional guidance. Response options also matter. They should be mutually exclusive, so no options overlap, and collectively exhaustive, so respondents can find an answer that fits them. For example, when asking about household income, it is important to clearly define income brackets that don't leave gaps or overlaps. An example of a good resource on the basics of questionnaire design is The Complete Guide to Writing Questionnaires: How to Get Better Information for Better Decisions by David Harris. Here are some examples of both bad and good questionnaire design, covering examples that include leading questions, questions that ask about two different things, vague questions, negatively worded questions, and using jargon in questions. This table comes from How to Create a Bad Survey Instrument, published in the Journal of Graduate Medical Education, which offers real-world examples of poorly designed survey items, including unclear wording, confusing response options, and questions that unintentionally bias the respondent. One of the core takeaways is that even small wording choices can significantly affect how a question is interpreted. And also how we frame our questions can determine how they are interpreted. A lack of attention to design details, including the order of response options, or failing to provide don't know or prefer not to answer options, can reduce data quality and exclude respondents who don't see themselves reflected in the answers. Over the past decade, a lot of effort has gone into adjusting how we ask demographic questions, which for many years were static things, to better reflect that people's identities are multifaceted, fluid, and deeply personal. Asking about race and ethnicity, gender identity, sexual orientation, language, and disability status is really just shouldn't be about checking boxes. We do now have updated frameworks and emerging best practices for demographic questions so that they are more inclusive and responsive to our changing population. We are not going to talk a lot about demographic questions in this specific training, but additional resources on the topic will be provided at the end of the presentation. I want to take a moment to point out that the evidence is clear. Shorter surveys produce higher response rates, lower dropout, and more reliable data. It can also disproportionately affect certain populations, particularly those with limited time, digital access, or survey experience. This is especially true for underserved or marginalized communities where barriers to participation may already be high. Now, please reach out to me if you have any tips on how to effectively convince people to run shorter surveys. It's something that I and many others have always struggled with. But one thing that I do when deciding whether to include a question in a survey is to ask, does this help answer my research question? If not, that is a question that can likely be cut from the survey. Every additional minute of a survey can lower completion rates and compromise data quality. When we design shorter, more focused surveys, we increase accessibility and reduce the burden on respondents, resulting in more representative and actionable data. When we talk about questionnaire design, we often focus on the wording, but the visual layout of a survey is just as important. How questions are displayed on the page can dramatically impact comprehension, response accuracy, and completion rates. Effective visual design considers readability, the ability to navigate the survey, and accessibility. Key considerations include the amount of white space between questions, how response options are formatted, where instructions are located, and how colors or borders are used to guide the respondent's eye. These visual cues help respondents interpret questions correctly and navigate the survey smoothly. Designing for mobile devices is especially critical. Many respondents complete surveys on smartphones. That means large grids, long tables, or dense blocks of text can quickly become barriers. Finally, surveys should be Section 508 compliant, ensuring people with visual, auditory, or cognitive impairments can meaningfully participate. Translation is a fundamental component of equitable design, but it is not just a technical task. It requires collaboration, quality control, and cultural sensitivity. One translation approach for quality control is back translation. In this method, one translator converts the survey into a target language. A second translator then independently translates it back to the original language. The goal is to compare the two versions to catch inconsistencies or loss of meaning. However, this assumes that both translators are equally competent. A second approach is collaborative translation. This involves multiple translators independently translating the same survey, followed by a structured review process. Translators, researchers, and possibly even community members come together to compare versions, reconcile differences, and agree on a final translation. Every change is documented, creating a transparent trail of decision-making. We now also have collaborative AI-assisted translations, where humans review and edit AI-produced translation drafts. Of course, it's important not to have an AI translate your entire survey without it also being reviewed by a human translator. While translation focuses on converting words from one language to another, transcreation goes further. It focuses on conveying the meaning, tone, and cultural context of the original question. Transcreation involves adapting questions so they resonate with the target population, while still preserving the intent and validity of the original item. This might mean using culturally familiar metaphors, restructuring a question for clarity in a different language, or changing the tone to align with local norms around formality, gender, or authority. Experienced native speakers are essential to this process, not only for their linguistic skills, but also for their cultural insight. Their feedback can help uncover issues that a literal translation might miss, such as unintended meanings or culturally inappropriate phrasing. Survey transcreation is not necessarily appropriate for every survey, but when done well under the right circumstances, it can enhance understanding, build trust, and result in higher quality data. Pre-testing is an important tool to identify issues with the survey before they affect the final data. And when designing surveys with equity in mind, pre-testing becomes even more important to ensure that all respondents can understand and respond to questions that we are asking. There are different ways to pre-test the survey. Ideally, it would involve a structured test with respondents, both to compare the survey and provide specific feedback about the questions and response options. However, one common barrier is a lack of time or budget on a project, which can limit our ability to do this. So structured review or feedback sessions with community members can achieve a similar goal with fewer resources. In pre-testing, we're looking for unclear wording, culturally mismatched questions, inaccessible response options, or any feature that could cause confusion or disengagement. These issues can vary wildly depending on the population, so it is essential to include a diverse sample in your pretest that represents the communities that make up your study population. Once you've collected feedback, revise the instrument, and ideally, test it again. Iteration ensures that you're not only just checking a box, but meaningfully improving the design based on real-world feedback. Let's take another pause to reflect on what we've covered so far. Think about your current or upcoming projects. Where might you have opportunities to incorporate equitable design principles? Are there specific parts of your process, question wording, layout, translation, or sampling that could benefit from a fresh look? Also consider your own learning goals. Are there particular topics from this training you'd like to explore in more depth? Maybe it's demographic questionnaire design, community engagement models, or 508 compliance. Please take a moment to journal your thoughts. When you're ready, we'll continue with the next section of the training. Now we will take a quick review of qualitative approaches to improve equity. In addition to surveys, qualitative methods like focus groups, interviews, and forums are powerful tools for equitable data collection. But they each have strengths and limitations, especially when viewed through a data equity lens. Focus groups can provide rich, nuanced insight into community perspectives. However, they may not be accessible to everyone due to scheduling conflicts, location barriers, or lack of comfort discussing sensitive topics in a group setting. Individual in-depth interviews offer a more private, flexible alternative. They're especially effective for exploring complex or sensitive topics, such as health, identity, or trauma, and can better accommodate participants' comfort levels and schedules. Community forums allow for collective feedback and visibility, which can promote transparency and trust. But they may exclude voices that aren't comfortable speaking in public or whose opinions differ from group norms. Digital platforms, including blogs, websites, or social media, can expand participation and maintain engagement over time. But they require reliable internet access and digital literacy, which may not be equitably available across all communities. Choosing the right method or combination of methods is about balancing inclusivity, accessibility, and the type of information that you need. When designing discussion guides for interviews or focus groups, it is essential to approach the process with the same equity-focused lens we apply to surveys. First, emphasize open-ended questions. These allow participants to express themselves in their own words and surface experiences that may not be captured in predefined categories. They're also more respectful of participants' individual contexts and viewpoints. Next, pay close attention to the language you use. Avoid jargon, acronyms, and overly technical terms unless you've clearly defined them. Use inclusive and affirming language, the kind that invites rather than restricts participation. And be mindful when discussing sensitive issues. Trauma-informed framing is key. Consider how questions may affect participants emotionally, and structure your guide to build rapport and trust before diving into more difficult topics. Ultimately, your discussion guide should be clear, flexible, and respectful. It should support your moderators while centering the voices and comfort of your participants. The following is one example of how we structure a focus group topic. It starts with a very open-ended question that allows for participants to share their own experiences in their own words and with their own stories. The follow-up probes are included to help the moderator guide the discussion to collect information that we are interested in, but often the conversation naturally flows in these directions. The probe questions are only sprinkled into the conversation when necessary by the moderator to get the information that we are looking for. Once a draft of your discussion guide is complete, don't stop there. The next step is to test and refine. Pilot testing means conducting interviews or focus groups with a small, diverse sample that reflects your intended population. The goal is to assess whether your questions are clear, relevant, and appropriate. Are participants understanding the questions? Are there any topics that seem confusing or emotionally triggering? Are you getting the kinds of insights you hope for? After collecting this feedback, revise your guide, and then, if resources allow, take the additional step of bringing it back to the community for a second review. Community members can offer unique insight into how your guide will be received and help ensure your questions are aligned with cultural norms and community values. This process may take more time, but the payoff is worth it. You'll end up with a more inclusive, more relevant guide that produces better data and strengthens your community engagement process. Let's look at a concrete example of how community feedback can improve a discussion guide. The following question is from a set of focus groups of Black mothers, many of whom were immigrants to the U.S., who had recently given birth. Our original drafted question read, how can providers assist and support mothers when it comes to culturally sensitive care? We initially thought this was a decent question, fairly clear and concise. However, when we reviewed the guide with community members, we received clear feedback that greatly improved the question. The final version of the question was changed to, how can healthcare workers include important cultural traditions in their care? The term culturally sensitive care, frequently used in the healthcare setting, was changed to cultural traditions, which was a much more meaningful term to community members. It also reflects a shift in power. Rather than framing cultural sensitivity as something healthcare workers do for patients, it becomes a conversation about incorporating patients' own values and traditions into their care. This small but meaningful change is more direct, culturally relevant, and grounded in everyday experience. It was easier for respondents to answer based on their lived experiences. Equitable design doesn't stop with question wording. There are other important factors that influence participation and data quality, especially among communities that have historically been underrepresented in research. Let's start with screeners. While screening questions are often necessary to identify eligible participants, they can inadvertently act as gatekeepers. Overly narrow or complex screeners may exclude people who otherwise have important insights to share. It is important to ensure that screeners are clear, inclusive, and don't send the message that someone's experiences are not valuable. Next is informed consent. While essential for ethical research, consent forms can be intimidating, especially when they include legalistic language or reference government institutions. For participants with limited English proficiency, cultural concerns about privacy, or undocumented status, this can become a real barrier. To address this, consent forms should be written in accessible language and provided in participants' primary languages. Take the time to explain verbally what the study is about, how information will be used, and what rights participants have. You may also need to look at alternative methods of obtaining consent that better align with the social norms of participants, such as through trusted community partners. Finally, confidentiality is essential. Participants must feel confident that their identities and responses will be protected. In some communities, particularly small or close-knit ones, this reassurance must be repeated and reinforced through the research process. The most thoughtful, well-designed survey or discussion guide still depends on the people administering it. That's why training your staff, whether they're interviewers, moderators, or analysts, is a critical part of data collection. First, cultural competence must be a foundational part of this training. Staff need to understand the cultural norms, values, and experiences of the communities they're working with. This goes beyond language skills. It's about empathy, awareness, and respect. Second, bias awareness is key. We all carry implicit biases, and these can show up in how we ask questions, interpret answers, or engage with participants. Training should help staff recognize and mitigate these biases in real time. Third, practice is essential. Reading a guide is not the same as using it. Role-playing, mock interviews, and real-time feedback give staff the confidence and fluency to conduct interviews in a way that is both consistent and responsive. I will wrap up this training with a quick overview of some ethical considerations. When designing equitable research, there are a few core principles to keep in mind. Accessibility. Make sure your methods are accessible to all participants. This might mean offering both online and in-person options, accounting for transportation needs, providing translation, or addressing digital literacy. Representation. Aim to include all relevant groups. That may require targeted outreach or culturally tailored methods. Avoid using the term hard to reach. It places the burden on the community rather than the researcher. Comfort and safety. Prioritize participant comfort, especially when covering sensitive topics. Use approaches that help people feel safe and respected throughout the process. Respect. Honor participants' time by sharing results, compensating when appropriate, and most importantly, using the data to create positive change in communities. If you're looking to dive deeper into the concepts and techniques we've covered today, we've compiled a list of additional resources. The following resources on questionnaire design include foundational texts on survey methodology, visual design principles, and community-based participatory research. We've also included a second set of resources focused specifically on demographic question design. As mentioned earlier, this is a rapidly evolving area, and it is essential to stay current. These resources can support your efforts to collect more accurate, respectful, and inclusive demographic data, which is foundational to any equitable research effort. Thank you for participating in this training module on equitable questionnaire design. I hope this session has provided you with a deep understanding of what it means to approach data collection through an equity lens, and how thoughtful design can shape more inclusive, accurate, and actionable research. If you have any questions or would like to explore any of these topics in more detail, we encourage you to reach out to the UCLA Data Equity Center. They are a valuable partner in this work and continue to lead efforts to make health data systems more equitable across the country. Thank you again for your time and commitment to this important work.